During the dialysis session, we have to give anticoagulation in the circuit so that blood won't get clotted. The anticoagulation, we commonly use the heparin, where the heparin pump, it usually delivers the heparin. There are certain patients where there is a risk of high bleeding. For example, a patient who is having urinary coagulopathy, there is a high chance of bleeding. In patients with cerebrovascular accident with intracranial bleed, anticoagulant should not be given. But what is the problem in not giving anticoagulation is, this is the external circuit in the dialysis. The blood will get clotted. During that time, there is one modality of dialysis called heparin-free dialysis. In that, we won't give any heparin. Then why blood is not getting clotted? It is because of some technique called in between we flush the entire circuit with the saline. As you see here currently, the blood is coming from the patient through the blood pump, through the dialyzer, going back to the patient. Yes, in this patient at least we are giving heparin. Suppose let us take we are not giving heparin. So what we do? We flush this circuit so that the blood will be diluted, clotting won't occur. The problem without heparin is the clotting inside the dialyzer and in the circuit also. The first thing that we do is flush the circuit every 30 minutes with normal saline. So now you can see how the blood is going to get diluted as we flush it. How much amount we use? Ideally 100 to 200 ml. इसको शायद close करके if we close this tube like this, ideally a glove have to be used. If it is closed like this, you can see the circuit is getting diluted with normal saline. We can do without closing the circuit also. If we close it, the effective dilution will be better. Now the blood is totally diluted in the circuit, in the post pump circuit. This is the pump. The blood before this is the pre-pump circuit. The circuit post pump is totally diluted. This diluted thing come to dialyzer also. Now you can see here the blood is dark. Here it is somewhat diluted. The color difference you can easily notice here, by which the clotting risk will be reduced. This have to be done every 30 minutes. For example, if every 30 minutes this much ml of normal saline we are using to dilute it, yes, the clotting risk is less, but patient will receive net amount of more water in the form of normal saline. That have to be adjusted in the ultrafiltrate. A total ultrafiltrate achieved have to consider this also. For example, in a patient, if we have to remove 2 liters of water during dialysis, if it is heparin free, if it is 4-hour dialysis, we have to take into consideration how much ml of normal saline went inside. It have to be added to the 2 liter. The final should be 2.8 to 3 liter should be removed. So this is one adjustment to prevent the clotting. The second one is the blood flow. Higher the blood flow, there is a less chance of clotting. If the blood flows at a lower rate in the entire circuit, there is a high chance of clotting. Preferably, you will keep the blood flow at the higher side to prevent the clotting. And this blood flow is not a single parameter based on which, like for example, anticoagulation should not occur, we increase the blood flow. No, other parameters like clearance have also been taken into consideration. So net for a heparin-free dialysis, every 30 minutes flushing with normal saline and a higher blood flow is preferred. Is there any other way of giving anticoagulation? Despite this, there are some situations where clotting can occur. What to do? First step is high frequency of flushing with normal saline. Another entity called regional anticoagulation is used. That is, once the blood comes out of the patient, The blood will be mixed with the anticoagulant. While going, it will be neutralized. That is called as citrate anticoagulation. Most of the centers that is being used in the CRRT, not in hemodialysis. So this is all regarding the heparin-free dialysis. Two important parameter, at least at that dialysis technologies level, two parameters you have to remember. One is the interval flushing, another one is the blood flow. And today you have seen how this kind of dilution happened in the post-pump circuit can be done with occluding the tube also and without occluding. Without occluding, the net effect will be somewhat less. Once I open this clamp, pre-pump normal saline clamp, the NS comes very fast. This you can notice over here. Suppose if I open that one, how fast the NS comes in this to dilute it. Now I didn't open. If you open it, it will come very fast. So this is all regarding the heparin-free setting in a hemodialysis. ठीक है,